South Africa's HIV/AIDS treatment and testing program has improved significantly over the past few years, say HIV/AIDS experts. But South Africa is still said to be the hardest hit country when it comes to HIV/AIDS infections, and school-going girls have been identified as a particularly high-risk group. Experts say schoolgirls are much worse affected by the HIV/AIDS pandemic than boys of school-going age, with about 1 in 5 South African schoolgirls infected with the virus.
There's some children who've been born with HIV. There's the occasional child that has acquired HIV through sexual abuse. But the HIV infection rates start increasing when the children become sexually active.
We have alarmingly high rates of pregnancy amongst school-going girls. And if you have such high rates of pregnancy amongst school-going girls, that means that they're having unprotected sex. And if there's HIV in the population, which we know there is, it means some of those girls are getting infected with HIV. So we have challenges like that.
South Africa's health minister and the country's president have slammed older men or sugar daddies for having sexual relations with young girls and identified this trend as a key driver of HIV infections in South Africa.
It's very, very serious. We know that girls between the ages of kind of 14 and 20 are infected with HIV at almost 6 times the rate of boys of the same age. We know that we have a problem of school-going girls having sexual relationships with boys who are older than them, sometimes out of school. And that is partly driven by poverty.
There are schoolgirls in this province who will have sex for a plate of food, if there's nothing at home. The temptation with some girls is to take a partner who's working and has money, either for favors for transport or for partying or nice clothes or a cell phone.
Our schools are very poor in many instances. We know that teachers are preying on young girls, that there's rape and abuse of young girls. So all of those are kind of contributory factors.
According to the experts, the impact of HIV/AIDS on the country's schoolgirls should be at the top of the education agenda, and special programs should be put in place to educate kids about risky sexual behavior and encourage them to finish school.
We really need to be very thorough with our safe sex. Obviously, religious leaders and parents and educators would like children not to be sexually active, but we do have to understand that it is a reality and that we need to deal with.
Rene, Carme, CCTV, Johannesburg.